Okay, so this is the third recording for the respiratory system, and we're going to talk about gas exchange. So pulmonary ventilation only brings new air into and removes oxygen-poor air from the alveoli. And again, this is more of a mechanical process with pressure and volume changes. During pulmonary gas exchange, oxygen is now going to diffuse from the air in the alveoli to blood in the pulmonary capillaries, and carbon dioxide will flow in the opposite direction. There are two processes that are involved in gas exchange. Pulmonary gas exchange, which is the exchange between gases in the alveoli and the blood, and this is the whole purpose of the pulmonary circuit of the cardiovascular system as well. And then you have tissue gas exchange. This is the exchange of gases between the blood in the systemic capillaries and the body cells. And again, this is the whole purpose of the systemic circulation. Now, one of the first things we have to look at is what we refer to as gas behavior. This is an important factor that affects gas exchange. Pressure that gas exerts and its solubility in water are important for driving pulmonary and tissue gas exchange. And Dalton and Henry's laws will sort of govern this. Dalton's law of partial pressures. Each gas in a mixture will exert its own pressure, or we refer to as a partial pressure of that particular gas. The total pressure of the gas mixture is going to be a sum of the partial pressures of all of its component gases. So for example, if we have nitrogen in our atmosphere, and that accounts for 78% of the atmospheric air, in order to figure out the partial pressure for nitrogen, you would take atmospheric air, which is a pressure of 760, multiply it by 78% or 0.78, and it comes out to 593, would be the partial pressure of nitrogen in atmospheric air. Oxygen makes up 21% of atmospheric air. So you would take 760, multiply it by 0.21, which is 21%, and that will give you a partial pressure of 160. Partial pressure of gas mixture determines where gas will diffuse. The rate of gas diffusion from high pressure to low pressure is determined by the steepness of the pressure gradient between the two areas. Henry's law, this is the degree to which a gas dissolves in the liquid, and it is proportional to both the partial pressure and the solubility in liquid. It explains the behavior of gases in air that come in contact with the water in the body. Nitrogen has a high partial pressure in air. Little nitrogen in blood plasma because the solubility in water is very low. Oxygen has a lower partial pressure than in air than nitrogen does. It counts for 21% versus 78%. But it's dissolved in blood plasma because it's much more soluble in water than nitrogen is. Carbon dioxide is actually got the lowest partial pressure of gases. Air is less than 1% of carbon dioxide by volume. It's also dissolved in blood plasma, and solubility in water is 20 times greater than that of oxygen. So during pulmonary gas exchange, which is referred to as external respiration, the diffusion of gases between the alveoli and the blood, oxygen diffuses from the air into the alveoli, into the blood, in the pulmonary capillaries, while carbon dioxide simultaneously diffuses in the complete opposite direction. This will then convert oxygen-poor, carbon dioxide-rich blood delivered to the lungs by the pulmonary artery in the oxygen-rich blood into oxygen-rich blood with less carbon dioxide. The now oxygenated blood will then flow through the pulmonary vein to the left atrium of the heart, where it can then be distributed through the systemic circuit. As with the movement of gases, pulmonary gas exchange is driven by pressure gradients, created by a difference in partial pressure of oxygen and carbon dioxide between the air in the alveoli and the blood in the pulmonary capillaries. Now, the blood in the capillaries has a low partial pressure for oxygen. It's 40, while in the air within the alveoli, it is 104. The pressure gradient that is established will now favor the diffusion of oxygen from a higher in the air at 104 to a lower in the blood at 40. The pressure gradient that favors the diffusion of carbon dioxide from the capillary in the blood is 45 into alveolar air, which is 40. Now, this is not as steep, but it is aided by carbon dioxide's relatively high solubility in water. And what will happen is the flow of gas for carbon dioxide will be from, the high of 45 within the blood to down the concentration gradient to that of 40 in the air. And you'll get the flow of outward. So here we can see the movement of oxygen from the alveoli into the blood and from carbon dioxide from the blood back into the alveoli. We do have what's referred to as hyperbaric oxygen therapy. This is when a person is placed in a chamber and exposed to higher than normal partial pressures of oxygen. This increases oxygen levels dissolved in the plasma, in turn increases the delivery to the tissues. This is used to treat conditions benefiting from increased oxygen delivery: severe blood loss, crush injuries, anemia, chronic wounds, and certain infections and burns. This can also be used to treat what we refer to as decompression sickness, or the bends. Bends is sometimes seen in divers who ascend too rapidly. Now remember, if you're going below sea level, you have more pressure. You can't just shoot right back up beyond a certain point. This is caused by dissolved gases in the blood coming out of solution and forming bubbles in the bloodstream, and therapy forces the gases to go back into solution, eliminating those bubbles. There are 3 additional factors that can affect the efficiency of pulmonary gas exchange.